Occupational injuries resulting from patient handling remain a persistent problem in the healthcare sector. In this video, we're going to talk about how patient handling relates to the aging of the workforce. And we're going to start by looking at some data from the Bureau of Labor Statistics Survey of Occupational Injuries and Illnesses. These are the rates of overexertion injuries in private U.S. hospitals by age group in 2010. Overexertion injuries often result from patient handling, and most of them are experienced by nurses, certified nursing assistants, and other nurse aides. Now you can see that these rates pretty steadily decline as age increases. And if you're like me, you might ask why. And you might start by saying, well, if it's age-related, it might have to do with physiological changes we experience as we age. But we know from research that over time, strength tends to decline, ligaments and tendons tend to become more brittle, and we work closer to our physiological capacity. So it's unlikely that physiology is the main driver behind this decline in injury rates. So if it isn't physiology, what could it be? Maybe it has to do with behavior. We know that job tenure, in other words, the amount of time that you've been at a given job, can have an impact. So that when you're in the first 6 months or year of a job, you're at an increased risk because you're unfamiliar with your surroundings and you're still getting to know the hazards in your workplace. And because young workers tend to be new workers, we often see, or sometimes see, injury rates highest among the younger age groups, which is what we see here. So the job tenure effect might be playing a role. Another behavior-related explanation is that, at least anecdotally, we know that sometimes older nurses or older workers will ask a younger worker, a stronger worker, to do the patient handling for them. A third possible explanation related to behavior is also related to this job tenure effect, which is that as workers age, they might become more averse to taking risks, or in other words, they may have just simply learned how to do the job safely. Now, turning away from behavior and focusing more on the demands of the job, let's consider how job demands might influence or explain these rates. As people age, they're more likely to be promoted into administrative or managerial jobs that require less lifting and less exertion. Another potential explanation has to do with something called the survivor effect. If a worker is injured at some point in his or her career, he or she is less likely to take jobs that require a lot of overexertion and a lot of lifting. So people may shift out of physically demanding jobs either because of promotions or because of injuries they've experienced, or both. These are just a few potential explanations of the observed trend in injury rates. Regardless, it's safe to say that the injury rate decline is likely due to a complex mix of factors, which might lead us to ask, okay, if we see the lowest injury rates among older workers, why would we care about overexertion injuries among the oldest age group? To get at that, we'll look at some more data from the Bureau of Labor Statistics. The previous figure demonstrated a decline in frequency with increasing age. This graph demonstrates an increase in the severity as measured by the number of days away from work required to recover from overexertion injuries. If we see a decline in frequency with increasing age and an increase in severity, that might have a complex effect on the cost effectiveness of intervening. Regardless, it makes sense to intervene and prevent these types of injuries from occurring if we know how to do it, both because younger workers experience higher frequencies and because older workers are more likely to suffer severe injuries if and when they get injured. So the question should be, how do we design healthcare environments for an aging workforce and an aging population, rather than an older workforce or an older population? After all, every worker and every patient is aging. By now, you have probably become familiar with patient handling devices and safe patient handling programs. Some states have even enacted legislation to require these for use in hospitals. These are going to be increasingly important for an aging workforce for the reasons I just described. They're also going to become increasingly important because the patient population is becoming older and more obese. But it's not enough to just buy the equipment. Workers have to use it for it to have its intended effect. In order to work, safe patient handling programs require participation in the design, implementation, and evaluation of the program. It's a lot easier to say than it is to do, but participation is essential. It requires input from direct care workers in the purchase of the equipment, in the implementation and use of the equipment, as well as the evaluation. Input from direct care workers is absolutely essential for these programs to work. It's also important to get input from all age groups, as opposed to getting biased perspectives from either younger or older workers. In a different video, we talk about generational differences in people's attitudes and approaches to doing work. But I'll say for now that generational differences are real, and they can either enhance or inhibit the success of a safe patient handling program. For example, you can imagine a nurse who's been handling patients manually for her entire life might have a difficult time shifting to a new approach. On the other hand, an aging worker who's experienced a back injury and understood what the true impact of improper handling procedures can be might be more likely to adopt the new, safer technology. In other words, there are a lot of nurses out there who learned the hard way about the value of safe patient handling devices and safe patient handling programs. Finally, participation from direct care workers and from older workers requires that their time is protected to participate. They need to be able to attend meetings, provide feedback, communicate with each other, and go to trainings without having to be worried about what their coworkers or what their managers will think. This requires that the whole organization, from the direct care workers on up to the CEO, is committed to the success of the Safe Patient Handling program. Now, that may sound like a lot to ask, but when a program simultaneously improves the health and safety of younger workers, older workers, as well as patients, it's probably worth it.